This program is brought to you by Stanford University. Please visit us at stanford.edu.
Really excited to tell you about a project I've been working on the last few years, one of the most interesting and gratifying things I've done in my career, about trying to help the Iraqis restore their mental health and addiction care system. Just start by saying I'm a small part of a very large operation that is got many important partners, most important being the Iraq Ministry of Health and of Higher Education and the National Mental Health Council of Iraq, but also excellent support from the British, great generosity from the government of Japan, substantial support from the U.S. government, and I want to single out the VA Palo Alto, which let me get some time off to do some of this work. The international non-governmental organizations like Movimento from Italy and Together and Diaconia that are working in Iraq, the World Bank and the World Health Organization have all contributed to this work. I do want to emphasize, too, the little asterisk there at the bottom is an important one. I'm not an official spokesperson for any of these organizations, so anything I say is just my opinion. So let me tell you the structure of one story about Iraq, and I use the word story advisedly. This is just one person's narrative. It's not the typical rounds where I'm going to give you the definitive answer based on research. Take it as a personal account. But I thought I'd tell you how I got involved, give you a little information about where Iraq has been in terms of healthcare and what's going on now. Tell you the goals of what we're doing, how we're trying to do it, the things that have worked well and the things that have not. And then last, I hope we'll have some time at the end to talk. So, how did you get involved in that? That's the #1 question I get asked. I think there's two motivations why people ask that. First is, sounds interesting, and so as a career advice point, they want to know how do you get involved in interesting projects. And they're also, I think, asking a second question, which is, why you, of all people, are you doing this? And that's a perfectly fair question. I don't mind being asked that. My first point is networks plus willingness equals opportunity. I think this is where most things come from. I was, a couple years ago, riding in a bus with a group of Iraqis away from the Dead Sea, listening to a psychiatrist from Iraq croon "Take Me Home, Country Roads," which is my home state song from West Virginia, because it was the last, it was in the 70s, is the last time they were allowed to get outside pop culture. And the guy next to me said, "How did you end up here?" And I said, "You know, I don't really know. How do we end up anywhere? We meet people, we agree to do things, and then here we are, you know, on the Dead Sea listening to Iraqi psychiatrists sing John Denver songs." And that is pretty much what happened. I had lived in Washington briefly. I had a friend who was a psychiatrist there who got involved advising an agency called Substance Abuse and Mental Health Services Administration. And she was helping them on Iraq work, and initially they thought the problems were mainly going to be around serious mental illness. But as the project evolved, they realized there was an addiction problem rising in the country. And they asked her, "Do you know anybody who could do this work?" And she remembered me from years ago and suggested me. And then it happened that someone who was an advisor at SAMHSA I had met a few years after that. I gave a talk that he liked, and we became friends. And he told them I was okay, and that's how I got the invitation. And the other part of it was that it was just the willingness to do it. One of the things I believe, not as an article of science, but more sort of an article of faith, is that if you want to be helpful, and I think virtually everybody in this field does want to be helpful, and you're willing to help, opportunities will be presented to you. The thing is, they just may not be the opportunities you actually thought you'd be particularly good at. I would have, in a way, I would have much better to work in Bolivia or Colombia, where I could at least struggle through the language. I'd never been to the Middle East. I don't speak Arabic. But I knew the need was great, and I knew the need for help was great, and so this is what I decided to do. Second point, though, that does not mean I was an expert in Iraq then, and I'm certainly not an expert on Iraq now. The world's full of people talking authoritatively about Iraq who don't know what they're talking about. So I'll just say, you know, the experts on Iraq are Iraqis, and I'm just someone who perhaps knows a little more than the average American. And if you've you know, lived in Iraq, if anyone here has, and you think you know it better than I do, you're almost certainly right, and I'd appreciate any correction or comment you have while I speak. The last point is sometimes no one's really qualified for certain jobs. They're just too hard. And I remember this story, Robert McNamara told this story that when he joined the Kennedy administration, Kennedy asked him, "Do you want to be Secretary of the Treasury?" And he said, "I don't know how to do that." And he said, "Okay, how about Secretary of Defense?" He goes, "I don't know how to do that." And Kennedy said, "Do you think I know how to be president?" No one's qualified for some jobs. So this job was so hard that essentially there wasn't, if there was a person who knew everything about Iraq and everything about science and everything about mental health and was, we'd know them all because he or she would have 5 or 6 Nobel Prizes or something like that. So everybody went into this from both sides, from Iraq, from outside, knowing we all have shortages in our knowledge. Most obviously because if you were living in Iraq under Saddam, you didn't get any of the information about what was happening in science and medicine in the last 30 years. If you were outside of Iraq, of course, you got all that information, but you didn't know what it was like to live in Iraq because you weren't there. So everybody had to come to the table saying, there's a lot I don't know. We'll just do our best as a team. So tell you a little about Iraq. Great, if you've ever done foreign work, one of the most important things is to study the people in the country you're going to work with in advance. It's a way of showing respect, and it's also a way of doing a better job. So I'll tell you just very briefly some things about Iraq. And here's the map you've probably all seen on TV. I'll just point out a few things if I can get this thing to work. First thing is, if you believe in kind of a guns, Germ, and steel approach to history, you know that physical factors really shape culture. So one thing to notice about Iraq is it has a lot of borders all over the place. It's got a surfeit of borders. Another important thing to say, there's virtually no stone in the entire country. So you put those two things together, this wasn't the kind of place where you could keep other people out. And the history of Iraq is full of invaders from all sides. And that does create a mentality over time of being suspicious of outsiders and being afraid of foreign intervention. This region here is the most holy region to Shia. You may have heard of these cities, Karbala and Najaf. Up here is the Kurdish region, and there's Baghdad right there. Now, Iraq has an amazing history, and I'm not going to go into details of all these historical words, partly because I'm not qualified to, but if you just look at the words on this thing, Mesopotamia, Gilgamesh, Hammurabi, the words we associate with sort of the oldest part of history, all those things happened in what is currently Iraq. The Hanging Gardens of Babylon, Ali Baba and the Thousand Nights, that all occurred in what is Iraq. So this history runs back, and it's very powerfully felt by the people there. So much so that even like a clinical case report in Iraq often begins by saying, 3,000 years ago, the first medical school was founded in Baghdad, and then goes da-da-da, and then the next paragraph is, patient was a 49-year-old male, blah, 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 blah. So it's always alive, and there's two parts to that. The first part I understood immediately was the pride of that, as they have every right to be proud. After I'd been doing this for about a year, a friend of mine from Tehran pointed out to me there's another component too, which is also there's a shame component too, because it's about how far we have fallen at the same time. So both those things are present in the mentality of the people, and it's something to negotiate. So I just want to talk a little about Sunnis and Shias. I think every responsible citizen should know what this is. Obviously, one of the most important things to understand about the country is the differences between the two large divisions of Islam. And you'll be misled about this if you ever read the paper where they're often described as ethnicities. They say the Sunnis feel this and the Shia feel that. But they're not ethnicities, they're religion. And this goes back to essentially the earliest years of Islam. When Muhammad died, there was a question of who would succeed him and whether it would be familial succession or sort of a more elected or chosen successor. And there was a war about this about 658. And the losing side was the Shia side, and the winning side was the Sunni side. The representatives of the Shia, the Sheriff Ali and his son, are buried in Karbala and Najaf. That's why those cities are considered holy. And this divide has gone on and been exacerbated partly by foreign powers. Persia was a Shia empire. The Ottomans were a Sunni empire. So when they were fighting over Iraq back and forth, that exacerbated the tensions within the local people. It's wrong to say, as is always said in the media, the Sunnis in Iraq do this. Usually what they mean when they say that are Sunni Arabs. But the Kurds are mostly Sunni as well. So many things attributed to the faith are just flat out wrong that I read in the paper. So then, moving forward, Obi-Wan Kenobi took over Iraq, and that's the 20s, that's, or at least his predecessor. This is Alec Guinness in the film Lawrence of Arabia, but they did have factually accurate that Iraq was created by British mandate and was ruled by King Faisal, who was not an Iraqi, and also the concept of a king was not an Iraqi concept either. So he never had any legitimacy completely, which I'm sure was the idea. He was always dependent on the British and so on. But the feeling about the West, if you have to remember, the Arabs were promised autonomy. They didn't get it. Goes back, this distrust, quite some time, basically for as long as Iraq has existed. Now moving forward, I've had this photo in my talk. I've given variants of this talk over the last 3 years, and the title has always been the same. The end of Saddam's regime has created an opportunity, to be differentiated from a promise that good things will necessarily happen. Even at the earliest days, none of the Iraqis I knew anyway were so starry-eyed that they assumed that getting rid of one tyrant meant that things would be easy, because their history is full of previous strongmen who fell, and then another strongman came in. That's true in the region in general. So it's always been that idea of this is a chance, a historical moment. They're doing their best to take advantage of it, but it's clearly not a guarantee. And that's even more true now, of course, when I first started doing this work. It has to be said, though, it is remarkable the amount of courage and effort the Iraqis have put into taking advantage of this opportunity. I was on the phone with a group of people in Iraq the day after the first election, and I think virtually every person was weeping in joy and pride. And to think the risks that Iraqis have taken, it's just remarkable. And I love this photo of this woman. I don't know who she is. I got this off the web. But people, since I'm a volunteer, not really affiliated with anything, people say, who are you working for? I like to think I'm working for her. This is the population. It's about 26 million people. Like most of the Middle East, it's a young country. About half of the people are under 18. It's mostly Arab country. As I said, there's a significant Kurdish minority. There's also other groups, Turkomans and Assyrians, much smaller in numbers. It's overwhelmingly Muslim. It's a majority Shia of those Muslims. The literacy rate is rather low, which has an implication for mental health education and things like that that one might want to do. Okay, let me tell you a little about healthcare. This is World Health Organization data on the proportion of physicians in different countries in the region. You can see here at the outset, even this is now pre-war data, Iraq only had 2 to 10 physicians per 10,000 population. This has now gotten lower because a number of physicians have left the country. And physicians have been leaving Iraq for 20, 30 years. Before that, though, what surprises a lot of people, and surprised me when I learned about it, is Iraq used to have a pretty good healthcare system in the 60s and 70s. If you'd been in Cairo and someone said, I'm going to Baghdad for a heart surgery, you wouldn't have batted an eye. It's like, why wouldn't you go to Baghdad? They had great medical schools, they had great hospitals. So it was very much part of what the people had come to expect, especially in the urban areas. But the resources in that started to get starved out right around 1980 or so, when Iran and Iraq, first the Iranian Revolution and then the Iran-Iraq War after that. And the starving was such that at the beginning of the Iran-Iraq War, Iraq was spending $70 per capita on healthcare, which at that era you would say that's a developing country on its way up kind of budget. By the end of the war, they were spending 70 cents per capita, which is less than, I can't think of a country that's lower. Malawi spends $7 per head, just as a comparison. And that caused a recrudescence of lots of, you think of third world problems, like outbreaks of cholera and things like that, that should not have happened in a country that had that much money, among many other damaging effects. And of course, it just got worse from there. Then the sanction period made things tougher. Then, of course, there's another war. Then there's the war now, and so on. So through this, it's been really shocking for a lot of the Iraqis who trained in Iraq to come back and see the dilapidated state of the facilities. It'd be as shocking as coming into this building and just seeing it stripped of all its supplies and everything like that. It's really quite distressing to those older physicians who trained in the old regime. The old healthcare regime, I mean, not the Saddam regime. The psychiatric care system is institution-based. I like to compare it to a fly trapped in amber. It reminds me a lot of what the U.S. system was like, or the British system was like, in, say, the late 50s. So there was no community-based care, no outreach, no sort of community treatment teams, but there are really big hospitals where people stay for a very, very long time. And the sort of perfect example of that is the Al-Rashad in Baghdad, which has more than 1,000 patients in it and has a length of stay that's longer than a decade. And the head psychiatrist I know told me honestly that he didn't know a lot of the patients' names, and no one else did either. So that's what you would have seen, of course, if you looked at a state hospital here 50 years ago. But it didn't, there was no progress, and so that's sort of where we started with this kind of fly-trap narrative. Even though healthcare in general was good, mental health was as backward as anywhere else. So what are the mental health and addiction challenges? I suspect you could all name them just from watching the news. Many people have been tortured. Many people have suffered horrible injuries. Many people have lost people that they love. Torture in the old regime also, where there was sort of secondary types of torture, like filming torture and putting it on CDs and printing it and sending it out to people, you know, so then it's, you know, both the torture, but then the record of it is made public. From a drug point of view, the biggest, you know, pool of poppies in the world grows in Afghanistan and Iran. The world's worst opiate and heroin problem is in Iran, so that's right next door. There's continuing fear, there's continuing violence, especially in Baghdad. Not all the relevant laws are in place or enforced. We have worked on that, on getting a mental health law and getting a law about drugs, but they're very hard to enforce because a lot of the country is so disorganized at the moment. The professionals have been demoralized for a very long period of being undermined and deprived of any type of new knowledge. So no journals, no travel, very poor access to medication, and so on. And there was nothing, as a group, Iraqi physicians are as smart as any other group of physicians, and they were originally well trained. But you can't put medical professionals in essentially a room with the lights out for 30 years and have them come out as being up to date. I mean, their skills have totally eroded. The workforce is also very top-heavy. I'll talk a little more about that. Again, kind of like the American mental health workforce or the British mental health workforce back in the 50s or 60s. There's just too many psychiatrists and not enough of everybody else is the setup. Actually, I shouldn't say that. There's too big a proportion of psychiatrists. There are not enough psychiatrists, but they're still in the model where everything must be done by a psychiatrist. So into that grim picture, what is the positives? Well, there's engaged exiles. Lots of Iraqi physicians left the country and did very well, were very successful in places like London and here in the United States. In fact, we had a chief resident, Saad Shaker, an outstanding psychiatrist who's from Iraq. And a lot of them are coming back to help. So they're probably the most important group, I would say, certainly more important than I am. Second, the cultural norms are sobriety promoting, at least in terms of alcohol. Their use of alcohol is far below ours by any stretch and has been. Next thing is they don't have any tradition of doing anything wrong, because when things are all smashed, it's not as if people will try to defend things the way they are. So, for example, in this country, we're often, in my field, addiction, trying to get addiction moved into the primary care setting. And some people say, well, we've got all these specialty programs built up that kind of creates some inertia not to do that. Well, they don't have that specialty care system, so when you say, how about we start in primary care, they say, fine, that's what we've got, let's start there. So there's that part. This is true if you've ever worked in a less developed country. Sometimes it's actually easier to make change than in a more developed one. There were 3 dogs that didn't bark in the night, someone pointed out to me during the initial invasion. 3 things usually happen during invasion that didn't happen, maybe because the invasion was so quick or it was well planned, I don't know. I'm not an expert on military stuff. But if you think about it, in the initial U.S. invasion, there wasn't millions of refugees, mass starvation, and outbreaks of infectious disease, which usually accompany invasions. So at that time, initially, we thought that's a much easier coming in after a war in that situation than what you usually see. And then the last thing, and the most important thing, is just the resilience and the sense of hope of the Iraqis. They're just such impressive people. I can't believe they take more risks every day than I do in a year to go, like, buy their groceries or something. And, you know, for me, trauma is, you know, when low-fat yogurt's not on sale, you know. So what's the workforce like? Well, the workforce, of course, was all sucked up into the military under the Saddam regime. So we think, what do you get? Well, you get people who don't know how to treat children, and they don't know how to treat the elderly, because those people aren't in the military. You also get very few people who can treat women. You remember, it's going to be same-sex treatment mostly. There's very few women psychiatrists. So that creates huge gaps in what they can do. I think there's one legitimate child and adolescent psychiatrist in Iraq for 13 million kids. Okay. They don't have enough nurses either, psychiatric nurses. So people told me that there would be situations where you have like 6 psychiatrists per psychiatric nurse in the hospital. Pity the poor nurse. I always think in that situation. And psychologists, I have met one Iraqi psychologist. There may be others, I don't know. There's a few social workers, but all those affiliated health professions are not there. So it's incredibly top-heavy at the psychiatry level. And the thinking can be kind of top-heavy too. I mean, just as one example, really bright guy said to me, a guy from Mosul, we were talking about primary care doctors giving SSRIs, and he said no primary care doctor should be allowed to treat depression until the patient gets a full workup with a qualified psychiatrist. And, you know, I said, well, if 10% of the population is depressed, you know, you would have to do personally, you know, 20,000 workups a year. Can you do that? And you realize immediately it was impossible. And this wasn't a case that he wasn't smart. It's just sort of a way of thinking that, you know, psychiatrists must do everything in mental health. And it's not, there were lots of smart people who thought that in this country and in England 40 years ago too. But they're still sort of in that mentality. They don't realize psychologists can do things, social workers can do things, primary care doctors can do things. So what are the goals? Well, I'll give you, just to compare, I'm in the VA and I worked on the Secretary's mental health plan. So just to give you a contrast, this is kind of a typical item in our veterans mental health plan. Component, 28 days psychiatric rehabilitation programs. Status, available in 18 networks. Proposed action, allocate $1.3 million to expand to 21 networks by July fiscal 2006. That's kind of that. This is an element in the Iraqi mental health plan. Regional mental health systems and governance, status, don't exist. Proposed goal, establish. And most things are like that. So we're really starting at virtually ground zero. The general goals are, 1, to organize everything around primary care. That's what they have, and a lot of times that's where you want the care anyway. 2, to develop a secure pharmacy. They've always had a sophisticated pharmacy, but there's always been a lot of corruption, and that's happening now. So a lot of stuff is going right into the pharmacy and straight out into the street. Modernize the knowledge and the structure of the healthcare workforce. Get people to go to conferences, meet outside experts, get their journals back, get them books back, everything they missed over the last 30 years. Prepare for the coming of opiates from other countries, especially Iran. Trying to get data started. This has been really hard because of the violence, but WHO was doing some work on just, you know, the actual, you know, how prevalent is mental illness, how prevalent is PTSD, and so on. Trying to get various non-governmental organizations engaged, and a number of them are engaged. And then this point I think is really important, is build morale. And often what I feel the most valuable thing, it takes a lot of confidence to be a good doctor, I think. And I feel one of the most important things I can do for my Iraqi colleagues is just take them seriously and tell them I have faith in them and I have respect for them, because it was so communicated that they had no value and they were so demoralized. And just to get that sense of morale back, which you really need to, you know, do something like run a hospital or a clinic or even treat a patient, that sense of confidence. Just thought I'd mention this. I'm interested in addiction and interested in self-help groups, and one of the fellowships that's been helpful to us is Narcotics Anonymous. It surprises a lot of people because it was founded, you know, here in Ohio by Christian people, that it's incredibly flexible in its spirituality now, so that it's been converted into Arabic and Farsi and is thriving in the Middle East now as well. And there was a convention of NA in Tehran last year that drew 10,000 people, for example. So this is one of the things I've been trying to help some of my Iraqi colleagues in the safe areas get going. So what have we been doing? So I'll tell you what happened, and then we're sort of back to my story. So they've just come back from Baghdad, and they asked me, they want to go back, everyone's going to go back to Baghdad the following March, and they said, will I do this? And I first have to meet, of course, with the Iraqi principal on this, who's been in Iraq for 6 months, but is back at his home, his British home in Rochester, and I happened to be going to London anyway. So I went down to visit him. His name's Dr. Sabah Sadiq, and I'm not going to, by the way, identify anyone by name, and I cut some faces out of my photos, except for people who have already publicly identified themselves through the media. That's just for safety's sake, because this is going to go onto the web. But anyway, so Dr. Sabai went there, and he had with him a eminent psychiatric colleague who had just fled because of a kidnapping attempt against him. I'll tell you a little more about that in a minute. But we spent a whole very wonderful day together. We walked around Rochester. I met his family, and then I enjoyed the classic risk of meeting an Iraqi, which is you immediately gain 5 pounds because there's enormous. I couldn't believe on the food. I was like, are there 40 other people coming over or something? He goes, no, eat. So eat, great food, and a very nice family. And we got on very well, and it was okay with him for me to be involved. The kidnapping survivors, he was had literally almost been taken right out in front of his house, and was very shaky and didn't know what to do, and had fled the country. And a lot of people are in this situation, a lot of physicians specifically. And there was a rash of this starting right about this time, early in the project. And this ended up, well, I'll tell you, it affected our work later on. So we then meet later that year now in Washington, D.C. So we have the attendees are the people from the U.S. government, health officials from the U.S. government, the local Iraqi community, American community in Washington. There's a fair amount of Iraqi exile psychiatrists in Washington. They came. People, and of course my friend Sabah and the other Iraqis and the people from England who were supporting. And you know, tried to work out what are we going to do and how are we going to set an agenda that's democratic and fair and all regions get to participate and all people and so on. So the idea is we're going to meet we're going to do projects all during the year, and we'll meet in Baghdad every spring to bring all the principals together. And at this time still, I'm reading Iraqi history like mad and all this kind of stuff, but I still, I've been doing this project for 2 months. So actually most of what I did felt like group therapy, which is when I don't know what I'm talking about, I usually just shut up and listen. And so I didn't say that much, but I found my group facilitation skills incredibly valuable to have rephrase, here's what the American official said, I think what you're trying to say is this, did I get that right? And it sounds like you're feeling really angry about that, is that true? And at the end people said, boy, you really contributed a lot. And I thought, wow, but I didn't know anything. But it was I retrospectively say it was contributing something, all these people from different countries all working together. There were certain politics and pressure that go all the way through this, and I won't go into them in great detail, but in-regional partners are really valuable when you're trying to do this stuff. Where would you get a lot of great mental health professionals around Iraq? Well, 2 countries have. Iran has very good psychiatrists. Israel has a lot of very good psychiatrists and psychologists and social workers. But bringing all those groups in, there was tremendous reservations from various quarters that you can predict, and that was frustrating to me, but I understand that's the way the region is. So in March we all meet, and you'll notice that doesn't say Baghdad. The central worry, there were several other efforts to kidnap physicians particularly, sometimes for money, sometimes for political reason, and the judgment of the people organizing was that they could not keep our group of 50 to 100 mostly health professionals safe if we met in Baghdad. So we moved across the Syrian desert. If you go straight west, you come to Amman, Jordan. That's where we met. I don't mind telling you I had mixed feelings about that. In one sense, Baghdad is one of the world's most historically significant cities, and I would have loved to have seen it. On the other hand, the thought of bombs and kidnapping scares me as much as it does anybody. And I think about that when I think I have friends working in Baghdad every day, that they're all braver and better people than me. But anyway, that's where we met, and at this time we thought Amman was safe. And these are just some of the people. I can show you American faces too. This guy ran the Coalition Provisional Authority. His name's Jim Haveman. That's Anita Davis, who's the leading psychiatrist at SAMHSA. We arrived a day early and went to Petra, which is a Nabatean settlement near Amman. We rode in this to just give a little flavor of what the region's like. Remember, I've never been in the Middle East before, so everything is amazing me. So who came to this meeting? Well, those leading psychiatrists, people who had run hospitals and clinics from Iraq. We also had religious leaders. We had the foundations are called waqfs that the different churches have. So we had a Sunni waqf representative, a Shia waqf representative. We also had the head of the Catholic Church in Iraq. He was an extraordinarily interesting guy who I happened to sit next to. And then global health experts, these are people like, if you know Rachel Jenkins in the UK, or people from the WHO who are just amazing, running from Darfur to Ethiopia to the post-tsunami, sort of people who can tolerate this incredibly, go crisis to crisis and do very well. And then a lot of senior government health officials on both sides and from the Jordanians. I'll tell you one story about the Father Mirkus, who was the head of the Catholic Church. I sat down next to him, and I was trying to figure out what to talk to him. I wanted to engage, and he mentioned first that he spoke like 8 languages, which was intimidating. So I tried to think of something we could talk about, and I knew I wasn't as smart as he was, so I said, I remembered Elaine Pagels from Stanford had done the Nag Hammadi scrolls, and so I said, hey, have you read about the Nag Hammadi scrolls, the Dead Sea Scrolls? He said, yes, I translated them. And I said, really? He goes, yes, from Coptic into Old Aramaic. And I thought, as opposed to that sort of trendy Aramaic that came in, a few years ago. And then there was this pause, and he was trying to connect with me. And so he said, do you know this book, M. Scott Peck, Road Less Traveled? And I said, yes, I do. Is he serious? I said, yes, I'm sorry, he is. And then we both laughed, so that we were able to connect in that way. But going around the table was so amazing at the very beginning. We sat at these big tables for our group. I've darkened this out a little bit, people would say, just tell your story, and people would say, this is no exaggeration, my name is so-and-so, I became a doctor in Baghdad in 1980, then I was conscripted into the army, I spent 3 years on the front, then I was gassed and I almost died, I survived, but then I made a negative comment about the government, I was put in prison and I was tortured, and I'm really glad to be here today to help my country. That was an average type of introduction. I was really interested about what the women would look like, in a sort of a different society. And I'm sorry I darkened this. I have to do this for some protection. But what's interesting is this colleague of mine has occurred. If you met her in Palo Alto, I think you just walked by her on the street. She looked totally westernized. But these women here are more in the traditional, with the headscarves and so on, are much more quiet. But what's interesting is they're not, it doesn't mean they're frail flowers of femininity. One is a judge and one is a surgeon. So they're very high power, but reserved in public. And like in a lot of countries like this, there's a division between how men and women act, obviously in public and in the home. And as my friend Saba says, if you're not afraid of your wife, you're not a real man. But also the friend who had been nearly kidnapped, in his introduction, he thanked his wife for preventing his kidnapping because she had come out in the street and driven away one of the kidnappers. The way we did this was, there wasn't enough time. I mean, we were working all day long for a week, but we had to have a fair amount of classes just to tell people what had been going on and what had been published and what new treatments were available. So we did that. We also had a half day where we went out and did something fun to sort of bond a little as a group. And then we had 2 days of small work groups. We were planning what's going to happen in Iraq, and people chose what they wanted to be in, whether it was mental health services or policy or workplace and staff stuff or science and research, in which there was surprising to me a large amount of interest. So we worked all day long on what we can do, what resources are there, what does everybody want, and so on. There were receptions every night. The Iraqis, they love receptions. We had lots of orange juice and strawberry juice and stuff. All of our meals were together, which I think was very important. And then we had a long closing ceremony where we gave everybody a certificate. It's another just sort of a cultural thing. They want certificates. That matters. It's important to them. So we did that. We had a ceremony. We had the American head of mental health, and Saba signed everyone's, and we all clapped. And that was nice. It was a nice sort of thing. Just some of the people I can show you. This is Minister Dawaze of Jordan. That's Charles Curry, who was the head of SAMHSA in the Bush administration, and I worked very hard there. That's John Wilkes, who was the UK lead. What was it like? Boy, I'm not going fast enough. Well, I think one of those important things, it was just an exercise in democracy. You can't figure out a whole country's mental health plans in a week. But I do think something that was very important was just the experience of getting to participate in a meeting, express your views, be a citizen, have some responsibility for health, and not be punished in any way. And as an example of that, Charlie, I showed you in the last one, he's the president's representative on mental health. We were in a meeting together, and we got into an argument about something, I forget what, about how many clinics or something. And we went back and forth and back and forth and back and forth, and then the meeting ended. And a friend of mine from Karbala said, so you're just going to argue with your government and nothing's going to, you just do that? I go, yep. He said, is something going to happen? I go, no, nothing's going to happen. And he smiled like a kid who'd been given a gift and said, that's really wonderful. And I was trying to understand the context for the story, and or context for why you know, you don't think of physicians as people who are typically scared to express their opinion. But I heard one of the most frightening things that happened to health under the last regime is that the health minister of Saddam, who was trained at Harvard, during the Iran-Iraq War, there was a cabinet meeting where Saddam said, I would like your candid views of the war. And the health minister said, I think the war is a mistake and you should pull back. He said, thank you, I appreciate that. And then he had the guy's body chopped up and sent to his widow. And that was the most powerful physician in the country. So you can imagine how intimidated just the average doc is to not express an opinion about anything at any time. So I think that process, just day after day of seeing this sort of exchange, everyone participates, there's no penalties for having a democratic process. I thought that was really important. We're trying to do a wrinkle in time in the sense that, you know, they have kind of the same impulse we did in the 60s. They want to go from the 60s to the 70s, but we don't want them to go from really big hospitals to slightly smaller hospitals. You know, we're hoping to just sort of jump all the way over and say, let's go right to a system that's entirely community-based, that has a huge primary care component. So that was part of the trouble of it. A lot of them also, for the same reason, they hadn't had any authority. They didn't think a lot about policy. And policy is very important, at least in my area, in addiction. You know, they would say, how do you treat alcohol problems, blah, 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 blah. I say, well, don't you need to make a bigger decision? Is alcohol going to be legal or illegal? Is it going to be taxed or not taxed? Is it going to be licensed or can anyone do it? Can you make it at home? And that level of thinking, which, you know, we engage in because we have this sort of expectation that policy will be responsive in some way, was a real struggle for them. I think it was fun for them, but it was a struggle. And the emotion environment was very intense and moving. I do not feel like crying at most conferences, no matter how bad the talks are. But I did often feel that way, just like wanting to, you know, after working like for 14 days with people, just the emotion was very high and very positive. And at this point, my wife and I were trying to have children, and a colleague of mine there kissed me and gave me a blessing in Arabic, you know, and then I went home, and then my wife got pregnant, and, you know, and I shared that story with him. So it just seemed like this, you know, it was wonderful. Just some observations about it. It's very psychiatrically focused. Religion is a huge factor in everything. Not that they're all religious, but they certainly think about how religious people will react to different things that one does. Smoking and drinking is a real striking. At the end of the day, the Americans and the Brits went to the bar, and the Iraqi physicians all smoked, virtually every single one. I ran a little addiction lunch for them, and I could barely breathe because everyone smoked. And I just thought it's just interesting how culturally these things are taught. And just to tell one quick story about it, there were two guys who were rehabbing a hospital in Mosul, and I said, we need to have an alcohol detox unit. And one of them said, well, no, that's too shameful. No family would want their family member in an alcohol unit. And the staff wouldn't want to work on the floor with an alcohol patient. And his colleague said, well, let's just lie and say they're heroin patients. And he goes, you're right, that'll work. He wasn't kidding. But you realize it's all just learned, what we think is, you know, that. I'm going to speed up a little because I want to sort of tell you where we are now. But just the other point, just about health imperialism, one has to be really careful in dealing with health. You realize you're really pulling on people's deeply held cultural values, and how important it is not to use health to make other countries like you. And this is an example. We all know there's heavy caregiving burden when, say, a parent has Alzheimer's. All right? But there are no nursing homes in Iraq to speak of. And when the very idea was raised, people got very upset. They said, are you telling me that I would not take care of my mother or my father? That'd just be absolutely horrible. And some people would push them and say, well, you've got to look at the, you know, the disability-adjusted life years and that kind of thing. But thankfully, no one there was of that mind. They immediately said, well, okay, I mean, we're not going to use health as a way to force you to be like us. We'll tell you what the information is. This is the way you want to do it that way. So after that, then the British very generously bring over a large group of Iraqi mental health professionals to West Kent, and they spend 3 months there working in the NHS. And I went over and taught during that time. And that was very important because a lot of things we do in mental health are really, it's not the technology that's hard, it's the thinking. And for example, the guy who ran this hospital with 1,000 patients and the decade-long stays told me with just incredible excitement that he had spent the morning with a social worker teaching someone with schizophrenia how to work a stove in a supported living apartment. And it was really just like as if I had, you know, as if I pulled an iPod out to someone in 1950. I mean, just the shock, the excitement. It's so fundamentally different way of thinking. People with schizophrenia can live out in the community by themselves with a little help. They don't have to be in a hospital. And once you have that thinking, the technology is much easier. So that, I think, was very important for them to get to see that, because they weren't allowed to see what was going on. Subsequent to that, then we did a drugs-focused thing in Istanbul, and I really enjoyed it, although I got a horrible case of food poisoning, but it was a very good meeting. And that was to bring them mostly with their Middle East partners to learn what was happening in addiction, to work together, because especially with the movement of drugs, it's clearly an international problem. You can't solve it on your own. Also, during 2005, we had new laws passed for mental health and addiction. They didn't have any real laws to speak of. NGOs doing service work, wonderful, brave people from various countries are working in Iraq. Many trainings are being held in Iraq for school teachers, for primary care physicians, and so on. The United Kingdom formed an expat support organization that has been very effective, raising money, education, and so on. So all these things are happening in 2005. And at this point, I'm at the peak of my optimism. And I tend to be optimistic anyway. If you know me, you know that. But I'm really optimistic now. And then things got really hard. The worst thing that happened, and I think historians will validate this, and every Iraqi agrees, the worst thing that has happened in Iraq is the Samarra mosque bombing. After this happened, there was just a tremendous sectarian split. It had not been there before, an intensity of distrust, and it just got worse and worse and worse. That was a real masterwork of evil behavior. And that made the government different, it made the culture different, it made people different. That was hard. Then there was increased violence up in the Kurdish region, which had been fairly stable, and in Baghdad. Then the Amman hotel bombings. We were, this is, as I said, I thought Amman was fairly, I had one little scrape there, but for the most part, I felt pretty safe. But, you know, that, one of the bombers, I believe, was on a visa that said he was there for a medical conference. So part of the problem we're having more and more is it's getting hard to meet in other countries and travel around, and also, you know, people are less willing to go to places where there's big bombings. Then the Hezbollah-Israeli conflict destroyed the Beirut airport, which I had used to get in and out, and was another place we used to get in and out. So we're just sort of we're getting more and more constricted. This is probably the worst thing that happened on the U.S. side, and I still feel horrible about it. Our government very generously gave a lot of money, hundreds and hundreds of millions of dollars, to build 150 primary care clinics in Iraq. And the contractor built, I think, 20 or 10. And when I heard that, I just felt like someone had hit me in the stomach. I was so crushed. You can imagine how the Iraqi felt. But I felt terrible, A, because it was my country, but B, because I had said that my country was going to do this. I had said this to friends of mine, believing it, and I was completely wrong. And this has just been a disaster. It's being investigated by, and all that sort of thing. But the point is, it didn't happen, and this was just been a real crushing setback. Because without that, everything else we're doing, there's no spine to put these things on. Increased sectarian conflict with government, everyone knows that. And then so just a lot of horrible things happened. One colleague lost 8 family members in a single day in a market bombing. Another friend of mine had a bomb placed on his house. One guy was kidnapped twice and ransomed twice and has now left the country, thank God. But it's just getting really hard, you know, and I'm certainly not going to sit in California and blame anybody who moves their family out of an area that has so many bombings. We did, however, have a few good things during this struggle period. We were able to get together in Washington in January, and we had a benefit at the Iraq Foundation that was well done, that does stuff for Iraq kids, and a press conference. I can sort of tell you a little more about press and why it matters. Finally, in February, after going through Dohuk, Erbil, Amman, and Istanbul, we finally found a safe site that we could get people to, which turned out to be Cairo, to have our next meeting. And we had that meeting. And then after that, the British again brought a group of Iraqis over to the UK, and I went over and did some teaching over there. Just thought I'd talk a little about press. There I am getting a hard question. But I'm grateful to Paul Costello and the group at the Stanford Media for helping us do this. But we did an event at the National Press Club in Washington, and there's been a lot of press on this project. And of course, as I said all along, not being a Middle East expert, I'm trying to think, what can I do, what can I give? And one thing that's true about Stanford is that people are interested in what we think, even when we don't know what we're talking about. We get lots of calls from the press. So I started to realize that I could sort of be a press officer for the project. In other words, when people would call me about Iraq, I would make this deal. I'll tell you, I'll give you any quote you want, but I need you to talk to a bunch of Iraqis first. And what that did was it let them say what they wanted to say in the media to an audience which is an important professional development. It's also important because it's their country. They have the right to do that. And also it raises awareness among the donor community, you know, of what's going on and what's needed. So we did that, and my colleagues did just a beautiful job. I was really proud of them. Saba Sadiq, who has been nominated by the Prime Minister to be the new Minister of Health, not just mental health, but the Minister of Health for all Iraq, and is in Baghdad right now, and I think about him, I pray about him all the time. He did a brilliant job. Hussam al-Athari is an addiction expert in Washington and has the added virtue, in a sense, much more important in the project than I am because he is born and educated in Baghdad, speaks Arabic. But we did that, and then we had spin-off things on the, very importantly, I thought, like Al-Hurra, Al Jazeera, Al-Iraqiyya, so it went out to the Arab-speaking world. And then CNN International interviewed and a whole bunch of people. But we think something like 20, 25 million people got to hear a lot about mental health in Iraq. And that generated a lot of energy and interest. And it was just a positive. It was sort of an up thing in a really difficult period where we were all struggling. And as I said, we finally did get to meet again. I cut my friend's picture out here for his sake. But we were originally going to meet up in Dohuk, which is up in the north. And then we were worried about getting across the Turkish-Kurd border because you have to bribe people and you never know what's going to happen. And then we're going to do Erbil, and then there was some bombings in Erbil, and then Amman, I mentioned the hotel bombings, then Istanbul. WHO didn't want to meet there because of the bird flu. They were worried. So finally, Cairo is where we ended up. But it was really hard to get people in and out. And I think at one point, one of the people to get it going had 50 passports, you know, in a bag in Baghdad, and had to like walk them through the streets and get them to the embassy to do this. So it's getting harder. Where are we right now? Well, there's been some turnover in the key posts in all the countries involved. SAMHSA now has a new director, Dr. Terry Klein, replacing Charlie, who I just met and seems like a good guy and is committed to this work, and that's good. On the UK side, John Wilkes has stepped down and been replaced by a great guy, Irvin Miller, who's interested in this. And in Iraq, I don't know who the Minister of Health will be. It may well be my friend Saba, which would be great for mental health because he is a psychiatrist. At the same time, though, we all know there's governance struggles all through the Iraqi government, so you know that's a real handicap. There's almost daily violence in Baghdad. We all know that. The travel restrictions are quite extensive, and some people in the country have had to move now for safety. So they're working in regions like maybe further south or further north than they're used to. They're displaced. Some people have left, gone to Oman, Kuwait, places like that. So all that's going to be a challenge. The best thing recently is just about 2 weeks ago, SAMHSA agreed, and we all met in Washington and arranged for sort of a home and away program for different mental health experts in Iraq, where people applied, went through an RFP process, and we have 6 teams now that will be funded to come to the U.S. and spend several weeks here working with different experts, and then go back to Iraq and implement what they've learned, and then come back and have mentorship and follow-up and that kind of thing. So that was, I thought, a good step along the way and sort of got us going again, tried to rebuild our momentum after some hard times. This, by the way, is my title, Sisyphus in Mesopotamia. You know, Sisyphus has to push that rock up all the time. And I often feel that way, but I remember, you know, that essay by Camus says, I perceived Sisyphus as happy. And I can't say I've been happy, but I certainly feel tremendously gratified and a great sense of love for Iraq. And so I'm not going to stop pushing. Thanks.
We have time for a few questions. You're open to answering some
Sure.
questions.
Chris.
How will the system be funded ultimately? If there is a federal system that's up and running, how will it be funded?
Well, the Ministry of Health actually has a significant budget. And so the question is, like in any country, getting them to commit to funding mental health adequately. And historically, they hadn't done that. I think it was, you know, an infinitesimal amount, you know, less than 1% or something like that. So that's where the change has to be, and that obviously, because in the long term, that's got to be the source of support for the system. Yeah. Right, right. Did everyone hear that question? So, you know, and it is true, and this is true in a lot of developing countries. There's so much need, and dollars seem so scarce. You know, it's sometimes very hard to persuade people to take any interest in mental health because they're working on, you know, cholera and clean water and that kind of stuff. And essentially what it takes is essential leadership. And, you know, Minister Abbas, who was at the beginning of this project was the health minister, said that his 3 goals for Iraq in health, one of the 3 was mental health. And appointing Sabah to be the mental health advisor, I thought, was that kind of leadership. I know Sabah will provide that kind of leadership if he ends up as the Minister of Health. But in between, there have been people who don't feel that way, and at those times it's very hard to make headway because there's a lot of other very, very legitimate demands on the health ministry, everything you can imagine.
What about the next generation of doctors, medical schools, and if all the wealthy families have gone away, who will enroll for medical school?
Yeah, so that's one of the central questions. The medical schools degraded and the nursing schools degraded just like the healthcare system did. And I talked mostly about the Ministry of Health, but the Ministry of Higher Education has also been involved with this very question of restoring and rehabbing those schools. And there's been a lot of countries around the world who have donated books, journals. When my friend Jim Haveman went into, I think it was the University of Baghdad, they had 1 issue of New England Journal of Medicine. It was like 11 years old. That was the only journal they had in their thing. So that all needs to be restored. And then the question is, will people still want to train and be physicians? My belief is that they will. It's a very high status profession. It's a very honored and respected thing for families, for extending through generations. And it's not a wealthy phenomenon. I mean, it's a deeply held value. So I think if stability can be restored, there'll be plenty of people who will want to be physicians in Iraq. I really do. Yeah.
How do people conceptualize things like depression, or how does that fit in with the Muslim culture or the culture in Iraq in general? It seems like among various immigrant communities that's thought of in different ways, and may not be amenable to the traditional kind of Western ideas of what depression or mental illness might be.
Sure. Couple of answers to that. One is, at least psychiatry as a field has a very long history in Iraq. So that there is a special class of medicine that deals with this is an acceptable notion and has been broadly. Second, got to remember that a lot of the physicians were trained in a British model and framework, so that part works pretty well. But it's a very diverse country, and there's lots of places where people don't believe in anything we would, see in the DSM. And at the extreme case, this is not the norm, I want to emphasize that, but there are some faith healers that everyone is scared of, both the medical people and the sort of mainline religious people, who do things like, ceremonies, stake-out ceremonies, with someone with schizophrenia, you put them out in the desert as if to drive out the demon, or those things, there's a bunch of things, but it's all just, scary, frightening stuff. But yeah, that happens there, and it's, you're not going to jump from that into comfort with modern mental health, that's for sure, not in that part of the world. And I should add one other thing too, is that maldistribution of mental health and healthcare in general is a problem all over the world. That's been true in Iraq historically. Something like 90% of all physicians lived in the Baghdad governorate. So you have areas that are very sophisticated about all this kinds of stuff, and you have other areas that never even had a primary care doc. So they're living in almost like a different century. I should probably stop there. Yeah.
Yes.
Okay.
All right, well, close up. Thank you very much.
Thank you.
The preceding program is copyrighted by Stanford University. Please visit us at stanford.edu.